OC World is made possible by the generous contributions of the Marisla Foundation, the Keith and Judy Swain Family Foundation, Orange County Community Foundation, the Cordoba Corporation, and viewers like you. Thank you. Hello and welcome to OC World. I'm your host, June Kim Lopez. Today we finish our conversation with CalOptima Health in our two-part series spotlighting the largest Medi-Cal insurer in Orange County. Joining us again are Clay Corwin, Chair of the CalOptima Health Board of Directors, Michael Hunt, their CEO, and Kelly Bruno Nelson, the Executive Director of Medi-Cal, CalAIM. Thank you for joining us again.
Thank you.
Thank you. So in our part one, we start to get into the state audit and your reaction as the chair of the board of directors. Now I'm going to turn to you, Michael. As a CEO, when you heard about the audit and you saw the findings, what was your reaction? But more importantly, what are you doing to address those points that were noted in the state audit?
So as a healthcare executive for many years and having sat in the CEO chair for a quarter of a century, I'm used to being under audited, in audit, and audited routinely because that's what healthcare does. You're always being audited for something. And those are built into the systems and structures on purpose because you want to have oversight and you want to have the ability to look at your organization and have third-party validation that everything you're doing is correct. On the acute care hospital side, that's the Joint Commission and CMS Medicare, and they come in and audit you on an annual or triannual basis and look at all your systems and structures. I was appointed the permanent CEO March of last year, so 22, and the audit was announced 90 days after arrival.
That's a good way to start.
One of the things that I like is starting with audits early, because when you're brand new to the organization and you're getting to know the organization, and the audit's going to cover a period of time when you weren't here, going back to 2014 through June of 2022, I'm like, great. Now I'll get a full systems structure look. I'll get an audit that's detailed, and the scope of the audit basically walk through all of our system structures, financial practices, and so forth. And it's a good thing to have those audits. So I welcomed it. I'm like, great. I like starting off, and let's identify anything that we need to correct, and let's correct it now. They spent thousands of hours, probably $500,000.
Who's they?
The state. So the state initiates the audit. Here's how it works. The audit can be called up by any state legislator. So one of our assembly folks asked for an audit to just validate that all of our system structures and financial performance were to state standards.
So, any legislator can request an audit of any organization and it just happens? Does it not go through some sort of a process, a committee, to actually say, yes, this is worthy of an audit or this is not?
So any member of the state legislature can ask for it. It then goes to a joint legislative audit committee at the state. That committee has to approve the audit. Then the audit is initiated by the state auditor's office. They then assign an audit team. They reach out to in our case, a public agency, and it's typically for public agencies that receive tax dollars. And then they initiate the audit. We receive an audit letter. We sign off on their scope of what they're going to be auditing. It's all kind of detailed out in their request. And then they initiate the audit.
Did you argue against the audit, saying that we don't need to be audited?
No, we welcomed it, and so did our board. Audits are always good. We're audited here every year already by DHCS, Department of Healthcare Services. We're audited by the state and various agencies for all of the work that we do in Medi-Cal. We're audited by CMS, Medicare for our Medicare program, and we have a program for all-inclusive care of the elderly called the PACE program. So we're audited by CMS for that because Medicare, Centers for Medicare Services. So anybody that carries a Medicare card like I do. And so they come and audit us as well. And then we have other audits with regards to our financial systems. We also have an independent audit of our books, our finances, and our balance sheet by a third party called Moss Adams. They're a national auditing firm, public firm, and they audit all sorts of businesses, including public agencies like CalOptima Health. So we welcomed the audit, asked the auditors what they needed. They started the audit process last July and then concluded it in March of this year. During the audit, they do not tell us what they're finding. They don't discuss their findings. They don't discuss anything that they're concerned about. They just ask for information and they interview all sorts of people throughout the organization, and that's a good thing. They're very independent. We don't disclose any of their requests. We don't disclose any of their conversations and discussions. We don't disclose any of their interviews with anyone else. And they do this as a closed process so that they have total freedom to audit without interruption or interference. And so we welcome that. They spent 9.5 months. They looked back almost a decade and came back with only 6 recommendations.
I want to talk just about a couple of the ones that stood out for me. One is the amount of reserve that is currently at CalOptima, $1.2 billion. And based upon at least the outsider reading into it, really the level that would be appropriate is about $570 million. So you had excess of nearly $670 million that the report said was just sitting there. And so can you talk a little bit about the financial decision, or maybe there was some breakdown to have that much additional reserve sitting beyond what is seemed as needed?
So a couple things, and the numbers, I'll give you current numbers, not the audit numbers. The audit ended in June of 22, so we're almost a year later. So a lot's happened in the last year. A couple of things that it's difficult for folks to always understand the process of what it is to have reserves at an insurance company. So we don't have $1.2 billion just sitting around not doing anything. Let me describe how the numbers work. As an insurance company, we're required by state law to have certain reserves to pay claims in the event that any of our providers fail to pay. So if you go and get services and the doctor's now owed money, somebody has to pay that. Whether that's us directly or one of our delegated groups, we have to have reserves specific to about 2 months cash on hand to cover the medical bills of anybody that receives care. And if any provider defaults, we're ultimately financially responsible. So the state requires us to sequester a bucket of money, it's about $600 million, and that can't be touched per state law, per state mandate. We currently have about 1.83 months of cash on hand. Our board will consider at this next board meeting a review of our current reserve policy. Different health plans across the state have different reserve numbers, and we will evaluate if we need to make a change. The Department of Healthcare Services right now is evaluating if they're going to require all public health plans like us to have a minimum of 2 months cash on hand. So we're waiting for the state to make that decision. So that's one bucket. The second bucket is monies that our board has already agreed to designate for programs and services. So the initiatives inside CalAIM, initiatives around homelessness, and I'll let Kelly kind of talk about all the monies that have been designated in the last 12 months. In the last 12 months, we have designated through our board approval $528.5 million. And all those dollars are now out in or will be out in the community, but we can't spend all that at one time. If we set up a 5-year program or a 2-year program, that money will slowly be released out to that designated program that the board has approved.
So how much of that, though, is going to CalAIM?
So for CalAIM, those dollars, I'll let Kelly kind of walk through it. There are dollars that come straight from the state to fund CalAIM, and then there are additional community support dollars that we're adding to the CalAIM type initiatives. And I'll let Kelly kind of talk about that. But we have designated in that already allocated bucket about $528 million right now. At our next board meeting, there'll be another $150 million designated. So when you look at a $1.2 billion bucket, you have about $600 million that's set aside automatically for reserves for the claims payment part, which is mandated by the state. You have another $528 million that have already been designated but hasn't been spent yet. Some of it is designated, but we have to pay it out over a 3, 4, or 5-year period. In current unallocated, unassigned money, before the board meeting on June 1st, we have $469 million. And we're going to designate $150 million of that in one meeting. So we are going to continue to be allocating and designated money across this fiscal year. So do we have $1.2 billion of money that's available that hasn't been spent? The answer is no. We have about 469, of which 150 will be approved by our board this next meeting. That bucket will always have some money in it. We'll always have some excess revenues, but that always will stay in Orange County and get pushed out to our community programs for principally access to care and quality of care and community supports that support quality and access.
So Kelly, before we get into the initiatives, Medi-Cal is to support the most vulnerable population, people who are not English speaking, lower socioeconomic status, and to try to, you said earlier, to meet them where they are. It sounds really complex and complicated. You're talking about millions and millions of dollars. There's money coming from here, money going there. How does one even understand what you do, let alone these new initiatives that you have? And I know we talked about communications earlier, but when I was looking at sort of the quote unquote, CalAIM is a long-term consistent to transform and strengthen Medi-Cal, offering Californians a more equitable, coordinated, and person-centered approach to maximizing their health and life trajectory. Mm-hmm. That seems like a lot, especially when it's kind of hard to understand the basics. So how do you navigate through that?
You're right, it is a lot. So thanks for acknowledging that. So California in CalAIM has really divided it into two sections. The first is something called enhanced care management, and the other are community supports. So I'll talk about the enhanced care management first. Enhanced care management is just that. Oftentimes, when you're under-resourced or the lower socioeconomic, as you discussed, you have several people that are trying to help you. Someone that may be helping you with housing, someone that may be helping you with your health care issues, someone that may be helping you with child care issues. What Medi-Cal has said is that basically everybody in the room, right? Everybody together, instead of having multiple people helping you with different issues, you're going to have one super care manager, if you will, and that's called enhanced care management. And so Medi-Cal has said that several individuals that have multiple issues are eligible for this service. Now, this is something that has happened sporadically in the county or across the state, but it's never been funded by Medi-Cal. And so that is a huge effort. And so, we anticipate thousands of our members will be receiving this service as it continues to roll out. And that allows individuals to better coordinate their care. So that's part of what you discussed, is how is that care going to be coordinated. The other part is you have to coordinate something. If you don't have the services to coordinate, what's the use of coordinating? So Medi-Cal has identified 14 different community supports that Medi-Cal health plans can elect to provide. So most health plans have opted for 2 or 3 of those services. CalOptima Health has opted to launch all 14 of them. So we are the only Medi-Cal health plan in the county, so feel a responsibility to ensure that our members have access to all 14 of those services. Now, just because Medi-Cal wants to launch them and CalOptima Health wants to provide them, that doesn't mean that there are providers and partners in the community that are ready to do that or at the level necessary. So there has to be an investment on the part of CalOptima Health to ensure, to invest in those partners, if you will, and to allow them to grow their capacity. So a lot of the dollars that Michael was mentioning is just that. It's our effort to work directly with the community-based organizations here in Orange County to give them the money necessary to build their capacity to provide those services to the individuals that need it.
So it really relies on that partnership. It's not just the CalOptima staff that's doing this. You're partnering with community-based organizations such as?
It's 100% important that we partner. So Latino Health Access, for example, Mercy House, Jamboree, there's many of them that we partner with. But our relationship with the community is key to making this necessary. To be quite honest and frank, that's why I'm here. You will be hard-pressed to find a Medi-Cal health plan that's hired somebody directly, specifically to launch their CalAIM efforts. They see CalAIM sometimes as a necessary evil, something that they're kind of hesitant in. CalOptima Health has leaned into this effort. They said, we're not only going to do it, we're going to do it the best that can it be done, and that's why I'm here. So we've just started. For example, we're expecting the board to approve on June 1st a $50 million investment in another investment into these services, $30 million of which will go to helping build affordable housing and permanent supportive housing for unhoused individuals. We have a homeless epidemic here, like every county across California, and the best way to resolve that is to build housing. But if nobody is investing in it, how do we do that? So we recognize that housing is health. That's one of the initiatives of CalAIM. And so we're taking it upon ourselves to invest millions of dollars into that effort.
So Kelly mentioned an interesting word, relationship, not just with the community-based organization, but the people that you serve. So when you go through something like a state audit, it tends to overshadow all the good programs and all the good results that have been yielded over the years. How do you get it back? How do you get that trust back? Because it seems like without that, the initiatives and programs won't be subscribed to.
Well, first of all, I don't think we've lost the trust. Again, as I mentioned, I think the results of the audit actually were positive and confirmatory of what a great job the organization is doing. Can we always do something better? Of course. And I think from a board perspective and my perspective, one of the things that we focus on is excellence. I think people look at a Medi-Cal insurer and our population of members and providers as somehow not being able to achieve the level of excellence that maybe others of us that have more traditional insurance or Medicare or whatever have achieved. And that's not the metric we live by. Our metric is to do excellence every day and to make that 1% improvement across the board every day. And that has to do with how the organization is run, how it's fiscally managed, how we spend these surplus funds across programs and services in the community, and as well as making sure that the programs and services that we're supporting are in fact the right ones, are in fact the ones that we have the right partners, and that we're going to see the results of what the money's being spent on. So nobody wants to initiate programs out there that are not managed well, that are not done with experienced providers and partners, and that's at the forefront of what Kelly and her team do, of ferreting out the organizations that understand our mission, can partner, and can execute on behalf of ourselves and our members.
So what is the ultimate, if the state audit was to find something that was, let's say, mismanaged, what does the board do if you say this finding, we don't agree with it? I know it predates all of you, but assuming hopefully there's not another state audit, but let's say there is, and you have some poor findings, what is the responsibility of the board to do with that information?
The responsibility of the board is to take that information and take whatever follow-up investigative due diligence and remedial action is appropriate. And I'll give you an example. One of the things in the board, in the state audit, was a finding, unbeknownst to any of us, that there had been a prior CEO that had been hired from the board, and that was potentially a violation of state law. So in response to that finding, and that CEO and that board, all those individuals are no longer part of the organization and haven't been for some time. Nevertheless, we have instituted a process to look into that, created an ad hoc committee of the board to run that to the ground, to understand how did that happen, what can we do to make sure it doesn't going forward. So that's our responsibility.
So if we were to look out for the next 3 years, Michael, based upon, I know you have a short history with CalOptima, but certainly want to talk about the vision, which Kelly spoke about, some of the programs and initiatives, and just the philosophy of CalOptima in what it's doing for its people. But if you were to look out 3 years, what for you as a CEO would be a sign or indicator that says that we are more successful now under your leadership than CalOptima has been before?
So a couple of things. I think first and foremost, I am very focused on our mission to serve our members with dignity and respect. I do weekly videos to our staff, and our staff hear from me every single week about everything from operations to programs to services to board actions to human resources updates. But I also make sure that they understand that we're here for the mission and the member. Every job in this building matters. Every one of our employees matter. Every function and system matters. I tell them, if you ever get lost and you're not sure why you're here today, put your finger on the corner of your computer and imagine the tens of thousands of people that you're touching right now, because everything you do is accretive in creating the work that we do in outreach. In addition, we can't do that without our community partners. 256,000 of our members are embedded in the community clinics here in Orange County and the federally qualified health clinics. We have to be in absolute partnership with them. So from a vision standpoint, integrated services without duplicating infrastructure with our community-based partners. I don't want anybody wasting money on duplicating the same thing over and over again. An extreme focus on how do you get the word out. One of my biggest frustrations in Orange County overall, and pretty much most places I've been in various counties, how do the people that are entitled to the benefits actually know they're entitled to those benefits? And so we're trying to create a collaborative and a coalition, if you will, of community-based organizations and dialogues to literally get the word out. Our awareness campaign that our marketing and communications team has put together is just extraordinary. And we are really trying to get the word out about things like enhanced case management, rent assistance, food assistance, medically tailored meals. We'll go into your home and put up a grab bar so you don't fall in your shower. We'll help connect you with doctors. Our board approved $6 million in this last few months to hire 100 navigators across the county embedded in the community-based organizations to help anybody, no matter their language, to navigate what they're entitled to receive. So from a vision standpoint, it has to start with the workforce understanding the mission, the work that we're doing to make sure that we're fulfilling the medical needs and the support of all of the caregivers that we contract with, our delegated networks, and working with our community partners. Overarching, we have to be a healthcare leader. That hasn't always been the case for Medicaid health plans. CalAIM has now put us squarely in the seat based on the governor's approval of that legislation. We are now sitting in a driver's chair and expected for the first time as a health plan, all the health plans are that are public, to start driving community health, start driving social determinants of health, and start driving the integration of services and awareness with our community-based partners. Up until January of 2022, health plans were not doing that. They weren't even allowed to do that. They weren't expected to do it.
Is that when CalAIM came?
CalAIM. So this is the big deal. So that's the vision over the next 3 to 5 years at least.
3 to 5 years. So we're coming to the end of the time. So real quick, Kelly, for your program that you're overseeing, what would be the number one indicator that you have achieved success in 3 to 5 years?
The number one indicator of success will be the number of individuals that are being served. Ultimately, and Michael says this all the time, we're not necessarily proud of the fact that our numbers are going up. We're expecting to hit 1 million members by the end of this summer. That's not necessarily a good thing. That means that folks are living in poverty and they need help. Ultimate, success would be to see those numbers go down, to be quite frankly, that people are being self-sufficient and they're healthier. But in the meantime, what we want to do is provide them with the caveat of services that they need to be able to be healthy. And that's how we would measure success.
So wrapping up with you, Clay, as a board of directors, is there a unified vision on your board? And if you were to just an elevator talk to say what that unified vision of all the 9 board members with very distinct different background, if you have a unified vision, what would that be?
Healthcare is, it's fundamental to the quality of life. Nothing is more fundamental to the quality of life. And that applies to every member of your community. And it doesn't matter whether it's you or me or a homeless individual at this stage. Their quality of life and their ability to have the kind of life that we all aspire to starts and ends with healthcare.
You're getting emotional. How come?
Because I think it's incredibly important.
Take your job seriously. So what keeps you awake at night from achieving that vision? What's your biggest worry?
Things take too long. Things take too long in this world. We all feel that. But what keeps me up at night maybe or thinking about these issues is you just have to start. You have to recognize the problem and start taking steps today that will bear fruit for the next generation. The serious problems that we haven't even touched on with mental health issues of our youth, those need to be addressed now so that it doesn't continue to spiral downward. That's incredibly important. Education is incredibly important. Moving some of our members from chronic and acute conditions back to a situation by taking steps, if they're educated, their families, their youth are educated early, will improve health care across the entire community. And it doesn't matter whether you're a CalOptima member or the other 2 million members of this community. Healthcare benefits everybody. Positive healthcare benefits everybody in this community. So we should all support it, whether you're directly or indirectly affected by CalOptima.
Well, awareness, education, those are important for all the critical issues, and you're taking on more and more, it seems like. And that's why for shows like us, we're a nonprofit OC World, we try to tell the stories so that it helps to communicate and build those connections. Thank you for joining us, and thank you to our viewers. Health, we know, is the most important thing, but we don't realize it until it's in jeopardy. Education, awareness, participation, these are all the things that we can do to improve the program. Whether we agree or disagree, is to make sure that we voice out our concerns and our questions to make things better for everyone in our community and for ourselves. So until next time, stay safe and be well.